Without further ado, allow me to introduce our speaker tonight, Dr. Avi Singh, who is currently pursuing MD Neurology at Emory University, Atlanta. So, how do you actually define Dr. Avi or describe Dr. Avi? So, carrying a stethoscope in one hand and pen in another, Dr. Avi is a passionate poet writing in four languages, that is English, Hindi, Urdu, and Punjabi, across various themes ranging from social or medical issues like autism and drugs to the most human emotions like love. Having served as the Vice President of AMSA India, leading a team of 200 plus state and college heads, he loves working with diverse teams and organizing events with real impact. He is also the editor-in-chief of Brainstorm, a national neurology newsletter, which essentially is his love letter to the dedicated to his beautiful subject, neurology. Dr. Ravi, the floor is yours.
Hi everyone. Thank you, Chaitanya. Thank you, Saj, for nostalgic introduction. I see a lot of beautiful faces here. It's a pleasure to collaborate with AMSA because people who know me and people who know AMSA, there's been a long-standing association, and I'm so glad that we have about 50 people now with us. One thing, if people who've attended my sessions before, super casual, super interactive, super useful, I hope. But one thing I really, really appreciate is if we can all turn on our videos. That way, we don't feel alone. The team that's been helping me so much doesn't feel alone. Um, Chaitanya, Sahaj, Malvika, Chavi, and everyone in AMSA has been super helpful. What I'm going to do is just help you describe a flow of events today so that we all have an idea how we're going to proceed. And I really, really genuinely hope that whatever I'm going to share is not going to be just textbook how to be during your interview kind of a thing, but things that really make sense to you. And we've gone through the questions that you've sent, but we'll keep some time still for people who still want to ask questions. And hopefully we can satisfy you with the answers from what are the common questions that are asked, from how do you present yourselves, from silly questions that you think are silly but aren't really silly. What is this okay to be asked, and can I expect this to happen? Can I say this? Can I actually say that I am someone who does not, that's my weakness, that I don't show up in time, and things like that. So whatever comes to your head, feel free to ask, because I'm not a program director yet, right? So I'm going to help answer the questions to the best of my ability, to what I have understood through my 20 interviews, how every interviewing experience was so different for me, and how I found that all those 80 to 100 people that I was in front of last year taught me something, like what really matters and what doesn't matter, and how much do we overthink as IMGs or AMGs or interview candidates. At the end, what I'm going to do is ask you for your Q&As, the questions that we have for you. We'll also save some time for a couple mock interviews. But I really hope that I can take out more time later in the month, if more people are interested in the mock interviews, if they make more sense to you, because right now I think we'll have to deal more with things that are relevant to everyone, and I think that's more important. And at the end, if you guys want to connect more and help other future residents, and we'll share more opportunities with you. So I think we can definitely start ahead, and at all times, Sahaj and Chaitanya, feel free to interrupt me, ask me things, whatever you feel like. Okay. So and I'm gonna like really genuinely spotlight certain people to help me just think what a good answer to that question can be, and no judging, because honestly that is how interviews are. You are not prepared for questions, and you just have to start feeling comfortable in speaking things right out of your head, thinking in the moment. That's what I did even after all the preparation, which I genuinely left, because I was like, I cannot prepare for 20 interviews, I cannot prepare for 40 pre-interviews. It's okay, let's just be myself. And I think that was the best decision I took. But at the same time, there are some things I expect you to know, I expect you to be prepared for, and then tweak them in a way that, oh, this is a good thing about me, I want to put it in my interview somehow. So you make that happen, right? Okay. So let's spotlight someone who's not turned on their camera, because that is how it works. Um, do we have Priyanka Agarwal? Hi Priyanka, how are you? You're muted.
Thank you.
Perfect. So are you applying this year?
Yeah. I'm applying this year in internal medicine.
Lovely. Okay, so super casual, super fun. What questions come to your head when you think you're gonna give your interviews? Have you given any interviews yet?
No, nothing yet.
Perfect. So I think this is gonna be a useful session for you.
I would like to start with tell me about yourself. I'm so
Okay.
sorry, I'm outside for the background noise.
That's fine. That's fine. I love the chatter. US is too quiet sometimes. It's okay. Okay, so do you wanna try walk us through what would you want to answer to that, or what have you thought about that, if at all?
It like I was thinking I would describe. I would like to hear your opinion first.
Sure. I mean, I'm here to give my opinion. Absolutely. I just want all of you to know that you're all in the same boat. You all think that some questions are going to be asked, and everyone's confused. Like, how should I talk about myself? Should I say things that are non-medical, like not medically oriented? How does that come across? Versus, should I just say things about which make me sound like an interesting person? Like, for example, I am someone, if I go to a party, I don't want to talk to people necessarily about how much interested I am in med ed, right? I would rather talk about the fact that I love Marvel movies, or I love just writing, or I just love going out. But this is an interview where you have to remember you are ultimately going to a medical position, right? You are going to be at a place which wants you. But the different thing is, you don't have to talk about how good you are at academics, or they're not going to necessarily ask you academic related questions. I've heard in a lot of programs they do, especially internal medicine, like, okay, there's a case of uh, acute myocardial infarction, how would you manage it? Sure, now that is your luck, your understanding. I am assuming if you've scored well in your exams, you know answers to those questions. So that is the reason a lot of times those questions are not asked. But if you think your basics at some point, like how do you manage a person who shows up to you with shortness of breath? And I get it. In a lot of institutes, we are so remote from studying medicine that we forget things, and I think that's a good thing to brush up on, especially if you're applying for internal medicine. Just know the basic cases that you need to be prepared for, but importantly focus on how do you are just a human being who's genuinely interested in medicine. So your conversations, your answers ultimately have to balance the two things. Like if you tell some trait about you, like I'm an inquisitive person. That was one trait I used. So now that is a trait that helps me both ways. I'm inquisitive in general. So I love watching geopolitical news, and I love just being curious about life and questions. But at the same time, being inquisitive helps me be a good doctor, be a good medical student, in the sense like I ask myself questions, and that's what pushed me towards neurology. And that's just one example. You guys have enough time. Think about traits, think about qualities that help you in both direction. I don't want to come across, I don't necessarily think it is the best trait to say I'm the most hardworking person, because everyone's going to say that, right? Unless you, that is something that really uniquely defines you, and then you tell me why, right? But use traits that define you, that help you in both directions, and use this time for that. So there are a few questions that I feel are are fair game to be prepared for. Questions like why USA? Because you are all planning to leave your home countries or wherever you are, and then come to a whole new different country, which is going to be so different, right? Number two, if you have been to the US, what challenges did you face? And if you did, how do you plan to overcome them? Fair game. Why internal medicine / why neurology / why dermatology, whatever you're planning to apply to. that is fair game, because we are so used to things being mechanical. We are so used to just giving our steps and like, oh, we are, the reason might be that like everyone does internal medicine, everyone amongst my seniors is getting internal medicine, or it might be I'm not super sure, but internal medicine is fair for now, and then I'll decide what to do later. But when I'm thinking as a program director, I want to ask you, you are choosing internal medicine. What is the reason? And you want to give me a reason that I feel good about. I don't want to hear like, that's what my seniors applied to, that's what IMGs get. Sure, that might be one potential reason, but ask yourself real questions that you would anyways ask yourself, or you would anyways want to have answers for. Same thing, why neurology or why dermatology? I think it's more important to stress with this with IM, because a lot of us aren't really sure of the long game, but just plan to answer it like that. The other question that a lot of people do ask is, tell me 3 qualities that define you. And sure, you can come up right in the moment, but like that was one thing I always, like I prepared it once. I asked myself, these are the 3 things that genuinely define me. So and somehow, not in every interview they're going to ask me about it, but I used to tilt it in that direction. If I have a prepared good answer, not in the sense that it's mechanical or robotic, but I'm comfortable answering it, like I know these are the 3 things that I want to talk about, then I will tilt whatever question you've asked me in that direction, because these are things that define me, right? That's fair game. The next thing that I want everyone to possibly be prepared for is just to make sure I'm not missing out anything for you guys, is one very specific question that used to be asked, like, what is one thing that is not on your CV and you want to tell me about, right? So let's just have someone volunteer. Priyanshu, do we have you with us?
Hey, hi, thank you for having me.
Perfect, sure. Do you want to just take a jab at answering that question? One thing not on your CV you want to tell me about.
One thing that's not on my CV, and I would like to share with you, that I enjoy Bollywood dancing a lot. And during my childhood, I was even formally trained for a few years doing that. And now I just use it to, as just as a stress buster and just to enjoy life.
Perfect. Okay, now my question to you is, had you ever thought about that question before?
No, I was not prepared for it.
And you know what? That is how most interviews are going to go. And that was absolutely fine, right? That was absolutely fine. Now I'm asking you a question that I am okay with having not a medical answer to, because anything that is medically relevant should have been on your CV. That's okay. Now I'm asking you that something that's not on your CV. So you need to like filter questions in your head right away. Like, is it okay to answer it medically or not medically, right? It's fine. When I'm asking you something like that, that's fine. I just want to know you as a person as well. So just have a filter in your head. Like if most of your interview is going about medicine or about academics, then it's okay to answer a couple questions which aren't in that direction. Same thing if most of it is going in a direction which is not medicine, and you want to like talk about, like the last question they ask you is, how about 3 things that you want to learn from this program, then you tilt that question towards, oh, I'm super passionate about medicine, and like what opportunities would I get. If your interview has been going in the direction of medicine, and then they ask you like, what are the 3 things you expect from this program, then I would be like, I know I'm going to learn medicine greatly at every program, but for me wellness matters. So what opportunities do we get for wellness? So there needs to be a balance, both from your end, right? And I think that's fair, because right now we are all in a space where we are like bus lay low, like just take us and stop, give us more interviews and we'll do anything for you. But that's not the real game. The real game is to be at a place where you feel happy. I know wellness is important for all of us, but right now we have been trained and being thinking in a way that just give us one interview and we'll come. But ask the right questions too. Okay, and I think just answering things that are truthful helps you in 2 ways. You don't have to be prepared, because that's the truth. And if you're truthful, that passion will reflect through your eyes, and which is very palpable, right? Like watching Marvel movies doesn't add anything to my academics, but it just makes me a real human, and that's okay. And literally, like, just sharing this experience, I literally had an interview at Mayo for a research position, and they asked me like, what superpower would you want to have? I was like, temporal manipulation, Doctor Strange. And the interview went 5 minutes about Marvel movies, and that guy turned out to be a crazy Marvel geek as well. And he was like, we can stop the interview, we already want you. So things can happen, right? Just think of them as regular humans, right? And don't be too hard on yourself, because anyone who tells me like I'm just nerdy and I'm just like the perfect candidate, that kind of might throw me off in a way. Like, I'm going to be working with you 4 years. I also want a fun person. I'm anyways going to teach you when you are anyways going to be taught, right? So maintain that balance, and sometimes judge. Like, you will get some interviewers who are very conventional, very old school, like who want to talk about, who will ask you on your face, this research, tell me about this research. And as long as that is honest and you've done it, you can talk about it. But judge according to what someone's asking you, right? Some people will genuinely read your CV and PS to an extent. They're like, they told me like, we already know you. Like, I know you through your PS and I know your CV. You don't have to tell me anything that's in your PS and CV. Talk me about anything you want to. And then I used to talk about my newsletter, because that I felt so comfortable talking about. That was something I was so proud of. So make sure you are adaptable enough to tilt your interview based on what comfort level you feel with the person in front of you. Okay. And one thing that might throw some people off is sometimes people are genuinely taking notes in front of you, like in front of you. And then you might feel like, oh, this guy's not interesting, or he's judging me, and you feel judged in that moment. And that throws you off your confidence. That's okay. Sometimes that's a game plan. Sometimes that's just the way some people operate. And it's very point based. Don't let your confidence drown. I'm telling you this because I want you to expect everything during an interview. And some interviews will be so nice that they will extract the best out of you. The sad thing that happens is your good interview experience happens somewhere middle of the interview season, and then by then you realize, now I know how to give my interviews, but 5 of my interviews have already happened. I wish I was like this during those interviews. So I want you to be a little prepared beforehand, right? The other thing is also, I have realized this time they didn't ask you about hobbies in your in your CV, but most or some of us at least mentioned them in as one of our experiences. I think interviews are a good place to talk about them, be it in a way that, oh, tell me one interesting thing about yourself. What if you have a hobby that you want to strongly talk about, or interest, or whatever? I think that's a great place. One of your answers could be in that direction, if someone does not necessarily ask you about your other interests or hobbies, because that is common as well. The other thing is, okay, how many of you, okay, I'm going to ask, just imagine I'm a program director and I'm going to ask someone a question and I want you to just take a jab at it. Okay. Again, hi, Fatima. I saw you somewhere. How are you? Yeah.
Hi, hello. How are you?
Good to see you.
Yeah, I'm actually currently in the hospital working. I want to attend this so badly.
I'll ask you.
Go on.
You can mute your okay. Jagriti. Do we have you, Jagriti? Hi, how are you?
Good. How are you?
Ready to be in the spotlight? I'm going to ask you a random question, okay?
Okay.
Perfect. Okay. So, oh, you did lovely. Would love to have you. Are there any questions that you have for us?
Absolutely. So I was I was looking at the website of your program and I looked up that you have multiple training sites, including a standalone children's hospital and multiple outpatient locations that residents rotate at. So I wanted to know that, how much often decision is on the part of the resident to choose how much time they would like to dedicate at different uh, locations of training, or is it the same for everyone?
Okay. So just assuming I have a residency program at some point, I would answer it. Okay. So about, I would say about 60 to 70% of your program is pre-decided, especially during the times like your preliminary year. We have a relatively fixed protocol for all people. 60% of your time is spent at the primary site, 20% is spent each at the secondary sites. But during your elective times is when you can definitely choose where you want to be at. And every hospital site has its own experience. Like just being at Emory, so I can talk about it. Like 70% of our time is spent at Grady, which is like a very community-driven hospital where you learn things hands-on. Like you are the primary of your patients. Like the attendings are secondary. You just manage your patients on your own. Being at Emory, it's very academic, it's very research based, it's very like, it's the top notch cases, like which you would literally have people come in from Chicago and other places. So I hope that question answers your question well. Are there any other questions that you might have?
I definitely want to ask about, how, I mean, I have I attended the open house that was held yesterday with the residents, and I got to know that you are very receptive to the feedbacks that the residents have to give. I just wanted to know, as the part of the leadership, do you remember any instance where a major change was, applied to your program based on a feedback from a resident?
Lovely. So I see you've done you've asked your done your research. I think nothing. We just started our program 5 years ago, and since then, if you look at our record, we've increased the number of residents because we realized that they reported to having felt being overworked, and we wanted to increase our elective times, and that's the plan. That's what we plan to do in the future ahead. And I think, sure, if you're interested in something like quality improvement, we are super receptive to you helping us change things in the future as well. But if you have any more questions at any time, please feel free to email me or the program coordinator, and we'll work it out.
Definitely. Thank you so much for answering.
Thank you. Okay, lovely. So now, being out of the PD zone, teaching point number one. Honestly, that is how it goes. Sometimes it's the program director, they are not prepared, they don't have the time, they will not necessarily have a perfect answer, they will just tell you what they genuinely feel. It's important for you to have questions that honestly matter to you, because at max usually you will just get an opportunity to ask one question. That tells me you are decently interested, you've researched, so I know that you have researched. That is your opportunity to ask a question in a direction that tells me about your passion. If you're asking me about research, I know you're interested in research. If you're asking me about meded, I know you're interested in meded. Whatever, right? The other advice I would give everyone is, if you are prepared with your question, like try to work it out in an elevator pitch kind of a way. Like you have all the time to prepare. So make sure you can ask that question in a max of like 10 to 12 seconds. Like it needs to be super clear. For me as a PD, you don't have to, like, I'm in a position where I don't have to be prepared, but you as an applicant, it's your opportunity to impress myself. And if it is something that you're passionate about, like research, like I always used to like if it was med-ed, or like for me it was like, I am super passionate about med-ed, and for me one big reason is the education track at your program. Can you tell me a little more about it? So this tells you crisp, tells you about my interest in med-ed, tells you like, oh, we have, and I'm asking this to a program which I've seen has med-ed. I'm not asking like, do you have a med-ed track? And then if they don't have it, then it's a no from me or whatever, but it's a no from them also. Like, he's interested in med-ed and we don't have a med-ed track. And that was a question. So you don't want to ask them questions that make them feel we are not the best choice for you, right? Now, I know you have a med-ed track, but I genuinely want to know more about it. Like, can you tell me, it's an open-ended question. Can you tell me a little more about it? Because that doesn't put them in the spot. They can talk whatever, right? So good job, Jagrati. Lovely. Okay. Anyone has any questions on those, or anyone who has a specific question for a program they're considering to ask, can just unmute yourself.
So hi, can you hear me?
Yes, but I can't see you.
Oh, my video is on though.
Oh, Purvika, hi. How are you?
Hi, I'm good. How are you?
Good to see you.
Long
And
time.
yeah, lovely.
So I'm worried about those behavioral questions that they ask at the end.
Okay.
So how do you tackle them? Or you need to brush up on our ethics from USMLE and go so that we know how to answer them or something.
Okay. Cool. Lovely question. Do you want to like take an example of a question that you think you might have?
Maybe like we are being burdened by overwork, like our colleagues are putting more work on us, or one of them is not doing much of her work I'm taking upon. How do I convey this to the people above me, or who should I convey it to, or how would I handle the situation?
Okay, lovely. So I'm gonna answer one of your questions, and then I'm gonna give myself a question, answer that question as well, two different questions, so that I think by an example, it's gonna really help people how to think, right? So to answer your question, it's there are things that happen practically, there are things that happen theoretically, and then there is an answer you give, which is in between those. Okay.
Yeah.
That's how it's supposed to be. Practically, theoretically, that shouldn't happen. If that's happening, then you reach out to the next person in the chain of command. Like you reach out to your immediate mentor, or most programs do have a big brother, sister, or a mentorship program. So you reach out to them. Then if things don't get sorted, you reach out to your mentor or program director, and then you don't have to mention that, because they are the program director, you don't have to tell them that still things don't work out, I will reach out to the dean. No, because then that
Yeah.
right. Practically, it's like you need to tweak it in a way that that makes you feel that you are also taking some of the responsibility, right?
Okay.
In a way that I know that getting into a new system is not easy, and I'm sure that I'll be facing some problems. So I am mindful of that, and making sure that I am doing things, adapting to things the best possible way. I'm gonna then ask for some advice from my mentors as well, and I'm sure they've been through the similar system, similar problems already, and I already did ask some things in the open house, and then I know that I will definitely reach out to you, or like, I mean, you have to put it as a last resort, but I think it's always important to take some onus of the responsibility yourself and put that across. I mean, there's nothing wrong or right about it, but it will just help them feel, this person's not he or she will not be as much of a task to take care of, right?
Yeah.
The other thing is like a question. For example, in my CV, I have I know 4 languages, and I know basic Spanish. And then I can be asked a question like, you might have a patient who does speak Hindi, like he's from the Asian background, he does speak Hindi or Punjabi, they do not know English, or you have a Spanish speaking person. Like, how do you think your skill is going to help in that situation, right? So sure, on my CV looks lovely. I know I'm super comfortable. I've been taking care of patients practically who speak in Hindi, Punjabi, Urdu, because it's essentially what we're thinking. So it's not a problem, but you have to know how the system works. In a lot of places, there are official translators, right? And the US system is a law about legality, right?
Yes.
Like, sure, I know it. Be there an emergency, I can definitely at least triage the situation. But if it's not an emergency, I know that I'm gonna reach out to an official translator, because there can be some medical things that I cannot fully understand or cannot make sure. I don't want to take that risk with the patient, and if I have that privilege, I'm gonna reach out to a translator. So that tells you're aware about the system. That tells you that you're not going to put the system in jeopardy, and at the same time you're also using that I have an extra skill. which is going to come in handy. Instead of, oh, I can talk to everyone and I can do this and this. That just tells me you're unaware about how the system works.
Yeah.
Right? Like, if you're a medicine person, I know how to handle seizures, I know how to handle epilepsy, but they see one single sign of this person possibly might be seizing and they call the neurologist because they're like, we don't want to be sued. Right? That is how the system is. So you need to be aware of how things practically work. And I think it's a good choice to safely use like whatever the strategy was with step 3, like step 2 ethics questions. You were like, I know this feels practically doable, that is just going too much, but let's just choose what seems ethically most correct, even if it's practically less so. I think that's, you ultimately want to, you can talk about everything, but your end point has to be like ethically correct, because if it's then it's the safest choice to be. You cannot be super comfortable with someone in a first interview, right? It's just
True.
10 minutes.
And those ethical rules is something that we are not used to in India. We just practice in US most of the things.
Exactly. So just, if you're ever confused, no, the law system is strong, and it's absolutely okay that I might not know everything. So I will reach out to my mentors and ask things before I proceed. That is something that is super common, and I love about the States is they are okay saying that we don't know, we'll ask.
Yeah.
Right? Just triage things. Is this an emergency and is this not? And if it's not an emergency, I'll ask because I'm new to the system, and that's okay. Than creating a matter. So I hope that helps.
That really helped, and thank you. I don't want to take much of your time. Too many people are waiting to talk to you. So
for people who don't know, Purvika was one of the most amazing state heads I had when we were in AMSA. So it's so
we were amazing because of you. That's all goes to you. You were awesome. Yes.
Someday, a reunion, a pending reunion.
Yes. Yes.
Okay. For the next question, let's talk to someone. Let's volunteer someone, because I had this question and this was a tricky question for me. Okay. Do we have Sirat? Okay. Or Utkarsh? All the lazy people who are like without their video, right? I'm gonna wake you up.
Hi.
Hi, how are you?
I'm good.
Good. Are you applying this year?
Yeah, I'm applying this year.
Okay.
Medicine.
So where are you from in India, Utkarsh?
I'm from Punjab, actually. I did my MBBS from DMC Ludhiana.
Okay, lovely. So I'm gonna put you on the spotlight, ask you a question, which I was asked. And
okay.
Okay, tell me about your internship experience. How are the hospitals? What do you work? What do you do in India?
So internship in India it's a compulsory rotating internship of a year in all the major departments, including medicine, surgery, and it's an acting internship, basically the way we have in the US. So I rotate with the residents, the attendings. I do all the work that the residents do in supervision of the residents and the attendings. And that's basically it. You can call it as a sub AI, the one we have in US. It's the same way in India.
Okay. And like, how much hands-on do you do in your internship?
Oh, everything. We do a lot of procedures, basic procedures. The residents teach us, the attendings teach us. Some examples can include cannulation, catheterization, tabs. We do history taking, physical examination. We put in the notes. So it's a very hands-on experience. Yeah.
Okay, lovely. So perfect. I think this is one question I want everyone to be prepared about. And then one tip that I have for everyone, because you did a great job, is ask yourself why this question was asked. Because they haven't been to India. They don't know how things work in India, right? One, sure, I want to make sure you know how things are done, because I might be skeptical, like, you're going to come to a whole new system. How much do you really know? But that is your opportunity to shine as well. India has crazy amounts of patients. Like, you have You have people that you take care of coming for illnesses in stages 4 because they don't have a lot of time. Great prevention, primary, primordial healthcare, right? That is your, like I talked about the amount of alcoholic liver cirrhosis we got, the amount of ascites we got, and the amount of experience we got seeing that, because that's not super common in the US because things are tracked at a very early stage. So tell them about it. Like we assisted, or like we saw so many ascitic taps, and like we were so comfortable with doing a physical examination on an alcoholic cirrhotic person. Like we saw like fluid, or it can actually stem from whatever you actually did, right? Like I had an experience with esophageal varices patient who was actively bleeding and stuff like that, or whatever. Talk about things that you think would be unique for an American person, right? You think TB is like super common. Like our literally pulmonary department is called chest and TB, right? Literally, like, which is, but we think it's so common. Talk about like people get paranoid in the States if you say TB, because they're like, whoa, what happened? Like the whole hospital is like isolated, shut down, whatever. So you want to talk about those things. Like I had an experience here, and they were like talking me about things and stuff. And I was like, literally, we had a person who had a dog bite, and he's getting paranoid. It's like we used to do like rabies clinic for 2 weeks, and this is how things are done. I used to tell my attending like that is how we take care of things and stuff. So I think that's a great way of just selling yourself from a point where you are the underdogs to a person who has greater experience, right? So be prepared for that. Okay. Okay. Now I think before I move ahead with a few things that I had prepared, we can ask a few people for a few questions. Or Chaitanya, do you want to ask a few questions that were asked to us?
Sure, just give me a minute.
Okay, let's wake up a few people until then. Hi Harleen, how are you? Hi Harbir. I'm literally gonna take names. Shrija, Pooja, Sakshi.
Yeah, shall I go ahead with one of the questions?
Perfect.
So someone has asked, please give more insight on the process to get selected for USC.
To get selected for the US clinical experience?
Yeah.
Okay. What I'm gonna do is keep this short because we'll focus more on the interview questions after this. But basically, the people that you know in amongst your seniors, reach out to 10 of them. One of them will be able to substantially help you out. You keep sending cold emails. I was not someone who could, but I have seen people who've literally gotten to great places just by sending cold emails. Research a little about the program, and then you put in a mail talking about it, and then you reach out to the program coordinator. Importantly, sometimes the program director is not going to be available to reply to you, and all of that and a little bit of luck is going to help you be at places for US clinical experience. And why that is important, because once you get a US clinical experience at a place, that's really going to increase your chances to possibly get an interview there, because you will know people there who are comfortable working with you over there. But more on that on my previous sessions. We can reach out to.
Do you want me to ask another question? Like,
Sure.
So what is the key to matching into a good university program? Is it USMLE scores, the number of research publications one has, or is it acing the interview?
Okay. Long story short, now once you get the interview, everything is the interview. Everything. You can have a 270, you can have a 280, you can have a 210. If I like you in the interview, I will take you. Just know that. So once you get an interview, your game is all about that. And you just want to be a person who does not want to repeat your CV, because all of that has worked. Whatever, that is unchangeable now. So I'm not going to talk about it more now. You have your US clinical experience, you have your scores, which will help you get interviews. But once you're in an interview, you want to be a super normal human being who is interested in that program, who's passionate about other things, and who is charming to talk to. I think if you are that, if you can present yourself well, which starts from you showing up on time, which ends up on you asking good questions, and which also has other parameters like, oh, does my interest align with you? Or if you are into education and my program director is like, we have an opportunity for education and you're asking me those questions, I will take you. And the scores are irrelevant in that situation. So a lot of times what happens is people are underconfident, and at the time of ranking, they do not thinking that the scores will matter. If you got an interview, your scores are over. So you make sure that you rank according to how your interview went, how you think that you want to be in that program, or how you think that they really liked you. So just make sure you know that. And one thing again I want to mention is sending letters of intent and interest right now. I'm sure like you guys are aware about some places are offering interviews to IMGs already. Some places have not started yet. So I think it's a good strategy to keep sending like subtle letters of interest every now and then, because I'm not promising you that you'll get replies, but you don't want to be in a situation where it's December and January and you're like, oh, the interviews are all sent already and they've selected everyone, and I don't know if that letter of intent or interest is really going to help. It possibly might. At the end situation, I will ask you like, whatever time you have, do send something, but just be aware if you are sending and not sending, and balance the fact that you don't want to irk them as well. Sure, send them once, cool, didn't reply. Now try send it to the program coordinator if the PD didn't reply, instead of sending it to them again, because nothing's gonna happen. Like they're not going to not get irritated by you if they've not replied you once. Just try sending it to someone else, assuming that the program director never opened her mail or opened his mail or whatever. So make a list of programs you genuinely are interested in and send them letters, I would say so. Or versus places where you have heard people are getting responses to the letters of interest, I would send it there, because that way I don't feel that I didn't try my best. I've had experiences where people did not get interviews till very long and they did send a letter at the end, and just by a stroke of luck they were like, oh, someone at least tried and we have a vacancy, so they would just possibly open it, right? So make sure you're not afraid to do that, but just make sure your letter of interest has something which talks about that program. It should not look generic. It should not be like, I'm waiting for an interview and let me just take a shot at your program because sure you've been sending it to people. No, like you want to come across as you're interested, or at least talk about why that city. If there's a genuine reason you want to be in that city, I think it's a very strong point. Some people do have family in certain cities. That's a super strong point. For me, like why I chose Atlanta, it was like I wanted to be at a good program as well as a good city, and that is what I used to write in my letter of interest. So Emory and Atlanta was a good combination for me. So that way you need to mention why that place, which is super important. Does that make sense?
Yes,
Cool.
absolutely. We have one question from Ayushi in the chat box. Do you suggest Sarthi for interview preparation? I have an interview in the next 7 days, like in the next week.
I haven't ever tried or had any interview preparations myself. And I think I don't know how the business models work for places, but there is absolutely no necessity to have anything mandatorily that you think will like, it's not like if you don't have it and you won't match, no one cares. If you think that you are stressed, maybe just ask someone around who knows you, to help you with an interview, who knows the interview process in the US. Does not necessarily need to be one program or place, and you think that you cannot afford it and you have to get it. It's not like that. Because at the end, in an interview, I'm genuinely going to ask you who you are as a person, and do you think that like giving an interview can change that? That would never change, and that is 80% of why I would want you. Sure, if you think you need to practice your vocabulary, you need to practice not being stressed, just practice with yourself maybe. Or I think it's more important to have an insight into what kinds of questions are asked And if you think if this session is helping you with that and you feel confident enough, you can save yourself a lot of money. Because I know you are in a vulnerable situation. I know I'm super confident. I know I'm up with my game. I have a good CV. I have a good PS, but I felt vulnerable when I was at that stage, having everything. So you have to know and balance what feels genuinely workable, and you can afford it. Sure, if I had crazy money, I would buy everything. Cool, why not? But we don't. And you have to make that hard call. It's not like, if there's no guarantee, no one's giving you a guarantee that you're getting an interview or something. So make that call for yourself. Same thing is something similar what I used to tell with the personal statements. Most people don't need to get that guidance. It's okay. Yes, for sure, some people might think that the grammar is a little poor, the syntax is a little poor, they're not great at writing. Sure, take help from people who are around you who can help you with it. But just getting it written from somewhere is not going to guarantee anything. In my head, if I ever get to know that, it would just be a downside. Like, it would be like, it's your personal statement. Why? Like, it is just biasing. Like, if you're over prepared for an interview, it's biasing me from getting to know the real you, right? So just be sure that you are the real you, and your core is going to remain the same. You need to sculpt yourself, right? And that's why I'm asking you to prepare yourself for those questions that are generally asked. Not that those answers are going to change, but you're going to be able to better present those answers, and that's going to impress me, right? Because you had that time, and then you took that time. But if you really feel that you need more insight, and I genuinely cannot answer about Sarthi because I haven't really taken it, but I mean, just make sure your money is well spent wherever it is. I think we as Indians or IMGs can definitely value our money a lot. So that's about that. Any other before Chaitanya, we go ahead, like, let's ask people in the audience who want to ask some questions before, right?
Sure.
What do you think?
I have a question.
Yes, Aisha, how are you?
Hello, I'm good. So it is related to the interview. If the interviewer asks why we joined medicine, so what do you think is the right answer to that question?
Again, I can just answer you what I think would be my answer. I can answer you about neurology, if that's okay. So for me, neurology was something, once I realized it exists, I've fell in instant love with it. And there are a couple reasons for that. I find there is this neurophobia out there. Like, people are afraid of neurology. Even if they know the right answer, they will just mess it up. And I had this situation where I explained someone the circle of Willis, and they were like, oh, no one explained it to us like that. And I just felt that if I can help someone free of that fear, it is such a beautiful realization. The other thing that I felt with neurology was it was such a perfect amalgamation of research, teaching, and being a doctor. And all of that, no disrespect to any other specialty, felt super, super made for me. And I can honestly see myself working as a neurologist for the rest of my life with a smile on my face. And that is essentially how I answered my interviews every single time. And see, there's nothing mechanical to it. There is nothing that feels like it's prepared. It's not true, and that's how it comes across. And same thing, everyone can have a very different reason. Someone can be like, I love the thrill that diagnosis gives me. I love when I can see my patients getting better. I love the patient interaction. I love the continuity of care in medicine. I love when I have a patient who comes in, and then I'm able to use my mind to understand what's really going on, try the treatments, and make them understand what's going on with them. So your reasons can be different, but choose one or two reasons and then talk about them with passion. I just need to know, like, in my head, is this person passionate about what she or he is choosing for? Yes or no? I want to say a yes to you, right? And different interviews will be different. Some people would love you to go at depth about it. Some people will just want to know that, are you really interested in medicine? Yes or no? So you want to keep it in both the directions. Like you need to be prepared. Like just analyze, this person wants to hear more, I can go on about it. If this person just wants to hear like why, I will just give a why. But you should have a why. That is the takeaway point. You should be prepared for that. Does that make sense?
Yeah, it does make sense. I was just going to say because my parents made me.
Yeah. So you don't, those are things you don't say, even if they are true. Okay. Cool. Sounds good.
I
Perfect.
have a question.
Yes, Priyanshu. Hi.
So imagine you are interviewing at a community program and you have a CV high full of research, and they bring up the point that, oh, what are your future goals? Do you plan to do any fellowship? How would you tackle that?
Okay. So honestly, that's a double-edged sword. So you need to do two things there, right? Sure. I have plans for the future and I love it. And this is the fellowship, because in medicine, it's common for you to do like either cardiology, nephrology, GI for whatever reason. But right now, you're not preparing for a fellowship interview. You're giving a residency interview, right? So I think it's a safe bet to say like, yes, for sure, I do have interest, but like I want to explore all my options. I want to know all of medicine and be the best at it. And maybe in 3 years, I have a better idea. But as of now, I feel that cardiology might be my thing. So you say it like, yes, I might be interested in certain things. That is the truth, but not in a way like I'm just getting over with these 3 years and then I want to be a cardiologist and stuff, even if it's true, right? Same thing with neurology is like, even if I am doing neurology, I'm like, I still have to do my first year of medicine, right? So it's like, I cannot be like, I'm just gonna get it over with, even if how much ever it might be true. Like, sure, I know that for me, medicine is just gonna help me become a better neurologist, because a stroke won't happen without hypertension or like thrombophilic events or stuff or whatever. So you want to convey that, because that will just help them. Like if a program has a cardiology fellowship and that's the reason you're choosing it, it's helpful for them that you're going to stay with them, right? So you mention it, but you don't mention it in a way that you are just overpowering that. Cool. Perfect.
How about research? How about having a heavy research experience and then interviewing at community programs who do not have the research support?
I
Or
then don't talk about it a lot. Don't talk about it a lot, because then even if they might want to push like, oh yes, you can do research, but like they won't say that we don't have the best resources, because you already know that a community program is heavy on work, less research. But you know what comes across, like this person might not be the best fit for us. Like he wants to do great research, and then like don't be too heavy on it. Just be like, I research is one of my passions and I plan to pursue it as well. And but at the same time, I know I want to be a great doctor and I want as much hands-on experience, right? So that's why being at this program greatly helps me. So you want to sway things in the direction of what that program offers you, right? If it's a community-based program, then you don't want to talk about things that they don't have too much, because that's just going to decrease your chances being there. And at this stage, it's not wise to like decrease your chances anywhere. Get as many possibilities from wherever you can, right? So it's not lying, it's smartly telling the truth, right? It's that. Okay, I will give the opportunity to a few people who've been turning on their videos so nicely. So hi Sahaj, how are you? Good to see you. Do you have any questions I can help you with?
A similar one, which was just asked. Like for example, if we're considering coming back to our home country after doing residency, is it okay to mention that, or does it look like we're not interested in staying in the US?
Okay. So it's again like it's a risky game, because one thing that I want you to know is it's better for the programs to feel that you're gonna stay with them. You're gonna contribute to their program. I mean, if I were you, so I would want I might put it across like, sure, I want to be at a place where I can learn the most, and ultimately my interest is like global health, or something like that. And then I want to travel the world, including helping my own country. So you don't have to necessarily say that I'm going to come to you, learn from you, and go back to my home country like that. Like, you know how that comes across necessarily, right? That in a way, I might think like, what am I gaining from that? Like, kind of a thing, right? Again, just my thought process, and which is absolutely fine. Ultimately, sure, you are the master of your own life. But just put it in a way like, oh, you're interested in global health. So something that might come out as a question mark, you want to put it as a plus, right? And that can possibly be your genuine interest, true as well. Perfect. We'll
Thank
talk
you.
more. No worries. Yeah. Okay. Hi, Zunera. How are you?
Hello, I'm good. How are you?
No, enjoying my Sunday
Can
with
you
you
hear me?
guys. Yeah.
Okay. I actually have this question. Like, I did one of these practice interviews, and I got asked this question. I didn't know how to answer it. How would you handle conflict? Like, for example, if you got into a conflict with a senior attending or a resident, and sorry, to add on to this question, another one is, for example, if you had a resident who had some traits that you could not get along with, and how would you handle that?
Okay. That's a super common question, and that's important. Thank you for bringing that up. It's not easy to answer, and you want to come across in a way where you're like, okay, understand. First thing first, if it's happening in front of a patient, that's a no-no. So you want to like get out of that situation calmly, handle yourself, and then you want to put across. You want to start in a way, having been in similar situations before. I think I have learned. I have my defense mechanisms. I have my ways to handle it. I think I'm not someone who reacts, who has a knee-jerk reaction. So I get it. People can have different personalities, and it's okay that not everyone has to get along with each other. So what you want to do is possibly take that situation calmly, get out of that situation, and possibly have a one-to-one conversation with that senior attending whenever everyone is in a calmer situation, and understand how and what went wrong and how you could have handled better. And like, feedback is huge here. Like, after every rotation we do a feedback. I give feedback to my attending is me feedback. So if you want to like ride on the fact how important feedback is and not giving a knee-jerk reaction, I think that would be very safe strategies. And then someone also did ask me, like, describe an incident where you did not get along with my senior back in India and stuff. So you can again like write down the same couple of things that initially I felt, and that's okay to accept that something went wrong or tending towards wrong in the past, but you want to come across, now I am prepared. Like, you don't want to say things like, I have never been in a situation like that, right? Which just make me feel like if you get into a situation like that, you will have a knee-jerk reaction. You want to tell me things like, I have worked with so many people and I've realized that everyone has different personalities, and I will have to accept, and especially being a junior or being someone who's still learning how the system works, I have to be prepared about how different people are, and that's okay. But my first instinct would be to have a one-to-one conversation, identify any opportunities that I could have done better, and share what I might feel that could have been done right or wrong, and give them an opportunity to explain themselves as well, because that way I have a clearer conversation. I always believe in transparency, or like an opportunity to improve. So they don't call it like, what did you do wrong? They ask you, what are the opportunities to improve? That's the terminology that's used. Like, constructive feedback, criticism is like the opportunities to improve. So I think that's a good phrase. But all in all, does that provide you a good idea of what I'm referring to?
Yes, thank you. And also, if they do ask you a specific scenario, then how would we know? Because you don't want to make yourself come off bad, right? So what would be like a good scenario to put in as compared to a negative one?
Yeah.
It's kind of
It's like, I can tell you what I talked about. They talked to me about like, tell me one challenging situation that you felt that you had. And so I genuinely had a situation where I was an intern in the emergency room, and we had a 80-year-old lady who got a cardiac arrest, and like I was kind of dozing off around 3 a.m., no patients, and then suddenly there's this code, and then I have to go and give chest compressions, and I do them, and I suddenly hear a click, and I realize that I've broken this lady's ribs, right? And that really got me like, in my head. I was panicked and stuff, and then I told myself that it's okay. She's 80 years old and she's osteoporotic, and if I'm going to compress her this hard, it's going to break her ribs, and I need to prioritize what's important, like getting her heart back. It's okay that a few ribs are broken at this age for her. And that was like, I just use that moment for a couple things. Like I tell them about my medical knowledge. Like I know it's okay to prioritize chest compressions over a rib fracture. I also tell them that I won't panic in a similar situation again. I also tell them that I have done things as an intern. I also tell them that it's okay that I have not been perfect. I have had incidents. I'm as human, and I'm sure if you can relate, there are things that have happened to all of us. We are all learning. So you want to identify an incident like that and have it with you, whatever your incident can be. But just make sure it's true, because they will have probing questions and you will only be able to answer them if it's true, right? So that's one. Yes, sure. Okay, Harbir, hi, how are you?
Hello, hi, Dr. Avi.
Good to see you.
Yeah, same here.
Any
So,
questions I can help you
yeah,
with?
I have a question for you. Like, whenever the program asks that why our program, so what were the points that you jotted down before answering the question?
Sorry, what things you look in a program?
Yeah, why our program? Like, why specifically this program?
Got it. So like I genuinely have my list of things that I want in a program. So most of my answers are like, okay, what does this program has and things that I need, and I stick them in, right? So things like, if it's for me a university based program was important because I want to interact with students, I want to do a lot of med ed stuff. The other thing that's important to me is a good city. Being in Atlanta, it's important. I mean, you can talk about things like that. That's what I'm telling you. The program will not feel bad about it, that you're not mentioning our program and you're saying the city. Sure, your program is good, but for me the city is important. The fact is that city is always going to be the city that program is in. So you being pro that city is also being pro that program. Okay, so you say that. If you have family, that is big. Don't feel like, oh, if I say family, they will feel that I'm just coming here for my family. They don't care. They care that you will be coming here, and it's a big thing you have family here.
Yeah.
So mention that, right? Other things, like for me, education track was important. This program offers an education track. That's great. Other things, this is for me, like I wanted a program with more neurology residents, because that helps like divide the load. So if a program has like 10 seats or 14 seats, that's like a pro for me, right? And like 14, like if sometimes it can be like, this is too big a program for me, so like 10, like Emory has 10. That was like, I used to shift my answer in those directions, whatever they had. Like Emory Neurology has houses. Like I was like, this is something which is so close to my heart, I would love to be a part of the house. So you slide on things like that. One thing that you don't straight away talk about is the visa, I think, because that sometimes, I mean, you can ask that. I used to ask that in the you have any questions for me? I used to ask them, how is your H-1B policy or your J-1 policy? Because I wanted to come on an H-1B visa. I ultimately got one, but I don't know how that might be taken. Like you're already interested in, like, ask that to a program coordinator later. I think that's better, because a program director would know the logistics, but they're more suited for more real questions, like why this program than what visa do we offer,
Yeah,
right?
true.
So
Okay, thank you. It was helpful.
um, so before we move ahead, I have a few things. We will wrap up this session with a few questions that Chaitanya has, but I wanted everyone to know about a couple things. We will do a couple mock interviews, but I will try. I can take a few mock interviews later whenever I get the time, and we'll be sending a feedback form. Chaitanya, you can put it in the group as well, and in the chat box as well. Make sure before you fill in there. Also, the plan is to take out more time to help as many residents, not just this year, coming in the following years. And if this is something that really interests you, and I think because this is one thing I really want to change. Until recently, what I felt, there are a lot of people who are like, they feel that if you help other people, it's going to snatch away your opportunities. It is not like that. And we have to break that cycle at some point. So medically mediocre is like one initiative that I'm trying to just do that, because you are the next league of residents. And if you feel that this guy's like sharing things that he's been through, like he's done wrong or right, you probably might feel that it's okay to share things what you've done right or wrong in the future with future residents. So I would be happiest to collaborate with as many people who are interested to join this initiative. Just let us know in the feedback form. There's a question for that. We'll keep sending more information. Happy to guide, help, mentor as many people as I can later in the year, but I cannot do everything alone. So I need help for sure. And I see great people. The other thing is, even if you're not a part, just make sure you keep helping people one-to-one in your own way. Don't be underconfident in your interviews. It's okay. People who want you will take you, will make an extra seat in the program if they want you that badly. So this country is great that way. Like if they really like you, they will make a seat for you. So make sure you're confident. For any other questions that you might have later as well, you are most welcome to just text me or follow me on my Instagram. I will share it with you. We will, oh, I think I just put it in a private chat, but we'll put it for everyone in the group as well. Feel free to follow us on Instagram or YouTube, or like AMSA always has great opportunities. Even later, feel free to stay in touch. The last thing I want everyone to also do is we might have a group photo before we leave. So I would love everyone to turn on the videos, and then we can continue the session. If you like the session, or if there's anything that we can help you with later as well, I would really appreciate everyone to turn on their videos before I start mentioning your names, because that's too much effort. Lovely. And please feel free to ask any questions till the very end. I'm happy to be here. I'm using my Sunday to help you guys.
Yeah, so there's a question in the chat box from Diksha.
Yeah.
I just had one query. What are some good questions to ask to the program director?
Cool. Okay, so after that photo, that's the first question I'm going to address. Sounds good, Diksha? Perfect. Sahaj, Chaitanya, are we ready to take the photo?
Yes, sure. On the count of 3.
Okay, lovely.
3, 2, 1.
Thank you. Okay, so perfect. Everyone's featured now. Lovely. Okay, for Diksha's question, what are some good questions to ask the program? Like I said, one thing you really want to ask is wellness, if your question has been about medicine, because that is something that you will realize is important. I used to ask about the schedule. Like they always have a tentative schedule, like how many elective weeks you have, how many mandatory wards rotations you have, how does the first year, second year, third year work. What is the big small mentorship program? Do we have any specific fellowships, and how do those fellowships work? Can I use my elective time for those fellowships? You want to line your interest in those questions. If you are into research, ask about research. What are research opportunities? But again, you have to be cautious. If that program is a community program with less research, don't ask your question about research. That is wasting an opportunity if you want to match in that program, right? If that question does not have an education track, don't ask about the education track. You already know that. You've researched that on the website, right? You don't want to make them feel that they're inadequate. You know everything, right? And at the end of the day, you want to ask yourself the real questions that matter, right? if there are more IMGs in the program, you already know that or you don't know that, right? So things like that are not good questions, I would say. Things that you can make out from the website. Ask subjective questions than objective questions. If you ask objective questions, that tells me that you haven't researched them enough, or at least what you can do is like, oh, I wanted to research this and I could not find this on your website. Can you tell me a little about this? Like, how does this work? Like, how does the schedule work? How does the first year work? And how are vacations scheduled or whatever? Only if you feel you're comfortable, because you don't want the first question to be about vacations, about your visa status, things about like that come across as like you are being too picky. Ask about subjective things like, I am passionate about research, like, and I've seen that your program is like prestigiously about research and stuff. And or things like, I'm passionate about research, how are the opportunities about going to conferences, how do they work, like do we have any funds from your end or things like that? How do vacations work? How do I get an offer? Again, to an extent you feel you're comfortable with them. If you feel that you can talk to someone about those questions, and it does not have to be the program director. There can be assistant program directors, there are sometimes fellows in there, there's sometimes very new attendings. You ask the right questions to the right person. With the program director, it's always nice to be a little cautious because they are going to have the final say, right? So I mean, be prepared to, and some subtle weird questions which you don't feel comfortable asking in the interview, ask it in the pre-interview to the residents, because as residents are like you and me. I will just answer questions genuinely. Like, you can ask me like how the city is to a point and stuff. And like I used to genuinely ask like, I would love to be in Atlanta because I love driving, and I can't do that in New York. So like, and what are your views about on that? So things like that. You want to let the program director feel that you're interested through your questions, right? Besides that, if you have any other questions that you want to ask, like, would this be a good question to ask or not, you can definitely ask.
Hi, Dr. Avi. I'm having a poor network connection, so that's why I'm not able to turn on my video, though I've been badly wanting to. Can you just tell me if I'm audible?
Yes, you are.
Okay, so I'm Sneha. I wasn't able to do really anything because of the network. So I'm currently in my final year. That is, I've not done my internship yet. I know this is particularly about the interviews, but I do have a couple of questions which aren't about the interviews. Is it okay if I ask them here?
You can drop them in the chat box, Neha, for sure. And towards the end, I think we can address them.
Yeah, okay.
If that makes sense.
Okay, thank you.
Thank you. Okay. Any more interview related questions that anyone has before we can move ahead? And I'll do like one mock interview towards the end so that you guys can have an idea. Like, it'll be an interactive mock interview, not a one-to-one, because I know we have a lot of people and not everyone's going to be comfortable saying everything, but just to give you an idea about how it works. Okay. And anyone who wants to volunteer is more than happy to volunteer. And we'll in the feedback form, we've shared people who are interested to give a mock interview. We'll share more information on that as well. But any other interview related questions?
There's just one last one from the Google form. How do I proceed with the step 3 preparation and interview preparation simultaneously?
Lovely. I love that question. So I think it's not easy because interviews have to be the focus. But honestly, if you know the right things, you aren't actively doing anything for the interview. I think it's a good time to prepare for your step 3. Don't over focus on your interview to an extent where you are like, you get burnt out thinking that everything has to be perfect. There will be interviews you will not feel great about. You'll be like, I did not get great vibes from it. And that's okay. And that should be a reason enough for you to not choose that or rank that program low. Trust yourself, how you feel in that interview. Couple things I want everyone to take away with is, it is as much their interview as much it is yours. You have to know that. That is why you are being asked to ask questions. The other thing I want you to know is it's okay to choose or rank places based on how you felt during that interview, because you are going to feel that way for the next 4 years. I felt such an amazing vibe with the program director I had at Emory, and trust me, that translates to date. That makes, like, we know each other, and I feel that my program director and I can talk about things because that connection was there during the interview. If I didn't feel that with someone in someone else's interview, that would be a good enough reason, like, to not be or to not rank that program high, because your program is going to be your family. So don't just base your rank order list based on how you've previously thought of that program. Your interview can help you decide you want to go up on a program or you want to go low on a program. And sometimes people do make a very objective list. Okay, these are the parameters and I'm going to give points and make this program go up and down. And sure, I set 10 parameters and this program is 93 on 100 and this program is 87 on 100, but I still want to go to an 87 out of 100 program. How do you like decide on that? So your instinct, your gut is important. Take in consideration all of that. And based regarding step 3, I would want to just mention that I think if you've given a step 3, and it can be a real like game changer during your interviews, if they know it, even if they talk to you about it or if they don't, because a lot of programs are skeptical if you'll get time to give your step 3 in your first, second, third year, and it gets difficult. If you can, trust me, give it. Not just because the programs will like you better, because you don't want to mess with a step 3 during your residency. It's like too much work. Just get it out of the way. And trust me, like, all my co-residents had not given the step 3, and it was so hard for them. Like, it was so much struggle. And because residency is its own curve, it gets hard. If you can get it out of the way, the earlier the better, because you can put a mail to all the program directors. Not sure if they really read it anymore, but they might. You can give it to the program coordinator, but at least it's going to help you talk to people about in your interviews. Like, if you've given your step 3 or you're preparing to, you can talk about it in your interviews. Like, I'm currently giving my step 3, or I'm currently preparing for my step 3, so that in their interview they will make a note of that. And if they make a note of that, they'll be like, oh, this guy's like not wasting her time. She's giving interviews and she's getting stuff done. I was told, like, how did you manage to do your electives and given your step 3 with a great score and now giving your interviews? How is this happening? And I was like, I realized at that point, like, how much value they give to you for just getting things out of the way. So, I mean, if you can, I want to push everyone in getting the step 3 out of the way for multiple reasons, long story short.
Dr. We
Hope
have
that.
2 questions in the chat box. Shall I go ahead with them?
Yeah, absolutely.
So, how have you grown in your profession by being the program director? How do you answer this question? Like, how do you ask it?
Oh, you want to ask the program director how they have grown?
Yeah.
Is that the question? Oh, that's gutsy. That's super gutsy. But I mean, honestly, I won't ask that. But if you really want to ask that, I would put it in a way like, what's the best? Like, I've heard people like, what's one thing that, what would you think is one thing is unique to your program, or like, since, like, it's a very difficult question to ask, right? Because you don't want, it's a program director. I would ask that probably to someone maybe else in the program, like, what's the best thing in the program, what has changed recently in the program. In the open house, I've heard people asking questions like that too much, like, what's the best thing about the program that you think, and what's the worst thing that you think is about the program. And I think most of them were American graduates, because they have that luxury to ask. You don't want to, I don't know, mess with it. But just ask them, like, how has, well, like, what is unique about your program, or what connects to you as a program director to this program. I mean, that's the sweetest, kindest way of asking about you, and they will answer what you really wanted to know anyway. If you ask that question, right? You don't want to put someone in the spotlight that you don't want to, right? So I think I hope that answers both practically and subjectively your answer.
Another question is, what do you think is the greatest challenge you are going to face while starting residency, and how do you plan to deal with it?
Okay, lovely. So I think you can definitely stem it out from what you feel is going to be an issue, and you can always say it in a way. Okay, you can always say it in a way that having come to the US, I realize it's going to be a different culture. It's going to be a different environment, and being on my electives, I think I'm well prepared to handle that, and just put your challenge in a way that you're ready for it. That there were things like having been in India, and realizing coming here, doing all your chores yourself and handling your life yourself. But at the end of it is like what I really want from my career is worth it. So I think I'm excited for a new life, although it will be challenging. But that's okay. That's fine. So you want to be up for the challenges and just put it in a way that I'm up for that yes, it will be a challenge, but I'm up for that challenge, right? You don't want to say things like, oh, we've never done electronic notes in India, I think that will be a challenge, because that will put you that will make me think that really is a challenge. You will learn it, you will have to learn it, but don't put it like that. Don't say things like, I'm always a latecomer, so I think coming on time will be a challenge, but I'll try make it happen. You don't want to say things like that. You want to say things which are environmentally challenging. You cannot change the fact that you're coming from India. It's going to be a different environment. Then that is worth it, and then tell how you worked around it, right? And so you want to make sure you just don't say things that would not want you to be in the program. Does that make sense?
Yes, absolutely. Just the last question, then we'll continue with the mock interview as we're running short of time.
Perfect.
I wanted to ask, is it wise to tell them the month in which you plan to give your step 3, as in if you have already scheduled it?
If you've already scheduled it. Okay. So I think there's no problem with it. There's nothing wrong with it. If they ask you about it, you can tell them, oh, I'm planning to give it next month and I'm already done with most of my prep and stuff. So I don't think so that is super significant, as long as you mention that you're giving it. I think that's a good way. And I mean, you have to wait for the right opportunity to mention it as well. You cannot be like, hi, I'm this, and I'm giving my step 3. Unless someone comes like, oh, so what are you up to these days and stuff? Oh, I'm just excited for my interviews and also preparing for my step 3 simultaneously. That's a very natural way of coming about it, right? So sometimes you need to tilt the interview in the ways that you want to take it. Cool.
Thank you, Dr. Avi, for answering almost all of the doubts. We can now proceed with the mock interview. We'd like to pick someone, or anybody can really volunteer themselves as well.
Sure. What we can do is anyone who wants to volunteer, it's not gonna be a real mock interview, because I would want that to be a one-to-one private session, because for very obvious reasons, not everyone should and is comfortable speaking everything in front of everyone. But just to give a hang of what kind of questions are asked, how does it feel, someone who just wants to help me with it, we can go ahead with it without your answers being genuine answers. That's absolutely fine. But before we go ahead with it, that's going to be the last part of our session today. I want to just remind everyone again, we'll put the feedback form here as well and in the chat box as well. Please make sure you fill them, because that's our way of knowing if we actually managed to pull something good today. And let us know if you want mock interviews. Let us know if you want to be a part of Medically Mediocre. I think those are the important reminders. And anyone who wants to volunteer for a mock interview.
Anybody who wants to volunteer can unmute themselves.
I would like to volunteer if that's okay.
Yes, absolutely. Why not? And then we can just ask random questions to everyone after that. Perfect. Okay. All right, everyone in the zone. Okay. So what we're going to imagine is no one else is on the screen, although we're seeing everyone. But we're going to literally take it like, Isha, you just imagine that it's your interview. You've just logged in. Okay. And then I'm going to be literally like a program director who's in there. And I'm going to time myself for those 10 minutes, for the 5 minutes that I'm going to take your interview. Right. I'm super unprepared. You are super unprepared. But let's see how it goes. Okay. Perfect. Okay. Hi, how are you today?
Hello, I'm very good. How are you?
Isha, am I pronouncing your name correct?
Yes, you're pronouncing my name correct.
Okay, so what are you up to, Isha, today?
Currently not currently awaiting this interview.
Okay, so I went through your CV and I went through your PS. You absolutely impressed a lot of the people on the panel that we have today. But I want to know things that are about you outside your CV. So tell me a little about yourself.
So, okay, about myself, the first thing that you need to know about me is that I am a huge anime nerd. Like, I can binge watch 10 animes in a day, and I'm not even ashamed. I love anime. My room is filled with figurines of all the animes that I have watched. And my favorite character, I'm not going to say who it is, but they recently died. So, I am a little sad if you don't mind.
It's okay. I see you're into anime and lovely. So do you want to tell me how did like medicine happen to you? Like why medicine? And I know it's not easy for someone who's settled in a very different country to come all the way to the US. So my two questions to you are why medicine and why USA?
Okay, answering the first question, why medicine? Actually, ever since I was 12 years old, I was deeply interested in neuroscience. I first heard about brain mapping when I was 12 years old, literally. And basically, that was the day when the mysteries of the brain started to elude me. And the fact that we literally do not know that we do not know about neuroscience, that it is still a huge area, it is still a huge gray area, pun intended, was basically what got me into neuroscience and medicine in general. I mean, I was little girl. I used to read Wattpad novels. I used to read mystery novels, and the biggest mystery in the world, it was literally inside of me. So that was my reason for choosing neuroscience. I'm sorry, that was my reason for going into medicine. And the reason why I chose neuroscience is, well, the reason is because I am heavily interested in research. I plan on winning Nobel Prize one day. So, and it is no doubt that USA's research facility is top notch, and basically that was the reason for choosing USA.
Great. So all the best on you winning the Nobel Prize. I'm sure I hope we can help you with that. I also see that you've done some decent amount of research. Do you want to talk about the most impactful research experience that you've had? Just a little.
The most impactful research that I did was in my second year of medical school. We were doing research on vaping on kids aged 15 to 25, and that was the most impactful research that I had ever done, because we went from school to school and we asked kids to volunteer, kids who used to vape. And in India, vaping, basically in all over the world, vaping or smoking, as people might infer, it is a stigma, and people do not, and children, they did not volunteer because they were afraid of the repercussions. They were afraid that we might tell their parents, they were afraid that we might tell their teachers, and basically the stigma surrounding it. But we went from school to school and we motivated kids, we talked to them as their peers, and we motivated them to be a part of our research. And we collected more than 214 students for our research, and that was the most impactful research that I had ever done.
Great. Isha, it is very evident, very obvious that you are very interested and passionate about research. I think the fact that our program is research heavy as well, besides obviously making you a great clinician, not everyone who matches has to be a doctor. They can be a doctor researcher. So I think we will be a great fit for you. I hope that you get all your questions answered by the rest of our panel. But should there be any more questions, please feel free to reach out to my program coordinator, or email me. You'll be getting the details very soon. But it was lovely talking to you. Is there any other question that I can help you with?
Yes, I do. I do have one question. What basically, what are your criteria on allocating research funds?
Okay, so basically we have a stipulated amount every year for students to either conduct research, or maybe we also sponsor their travel expenses and registration fees to research conferences. The research fund actually is renewable every year. So I think that just speaks about how much we value students participating in research. But the details of it, you can definitely find more by reaching out to a program coordinator.
Thank you for answering my question.
Okay, Isha, it was lovely to see you, and I hope to see you soon.
Thank you so much.
Okay, perfect. A few things, lovely. First of all, I want everyone to know Isha is super young in this journey, and I'm so proud of you that you volunteered. And it's not easy to be put in the spotlight. And I think you did great. And I will definitely just share a few things that I feel that can be improved in there. And I'm sure by the time you are applying, you're gonna be just perfectly ready, sculpted to match at wherever you want to go. You already have a lot of feathers in your cap. One, once you are preparing, and how, depending on how much you can gauge the person is making you comfortable, right? It's anxiogenic. If I'm a PD, just the fact that I'm a PD, it's anxiogenic. It's for me, it's for everyone. Gradually start being comfortable. Make sure all your answers have you're sure about making sure you have a time limit to them. You avoid redundancy, because I will have only 10 minutes for you, right? If you speak 3 minutes about one answer, 4 minutes about one answer, I'm going to run short of time. I have other people to interview, right? So you need to make sure, like, have a list. These 5 things I need to talk about in my interview. Just touch them on. Sure, I have 4 or 5 minutes which are extra, and they want to, I can talk about them if they have the extra time or if they are interested. But at the same time, you want to, like, there are some questions like that you genuinely want answers to, but the PD doesn't have time. So you use those questions with the other interview panelists. Like, how about like, I'm genuinely, like, this question could make sense here, or like, if my program director is a certain kind of a neurologist, so I can ask that question to my program director, which makes more sense to be asked to her. Everyone on the panel has different roles. Someone's an assistant program director who might be taking care of the education department. So make sure you ask that education question to that person, right? The next thing I want you to know is, again, like I said in the beginning, balance the medicinal aspects and the personal aspects, right? So if you don't know me yet, you can definitely talk about anime, and you can tell me, like, I'm a huge sucker for anime. I can watch them day in, day out, whenever I get time from my busy schedule, whatever. But then you judge, like, if I'm not interested in anime as much, or I'm not, like, interested in you telling me about a lot beyond that, you stop there, right? Because then I need to know, like, because we are using that time from your important interview minutes, right? Same thing, if I ask you about your hobby, that is why the safest thing is to try take a hobby which helps you in both directions, because then you don't have to judge that time in both ways, right? So, like, when I used to do medical poetry, that used to help me with 3 things. Like, I have like 10 different hobbies, but I will choose to talk about something which helps me with medicine, tells me about something I'm outside of medicine, and I think it's a fair bet most people will be interested. But if I send someone who's not interested in my poetry, they're like, just tell me about your medicinal accolades. So I will be like, okay, you're not the person I need to talk about medical poetry to you. So I need to be very adaptable in that moment, right? So those were a few things. I necessarily didn't ask you a few questions just to give a hang of how it commonly is. Sometimes it's just very casual, straightforward questions, and PDs have very limited time, right? I'm just going to share a few couple questions that I feel that sometimes are still asked, right? Which what we didn't address, but were asked to me during my interview. Tell me one thing that you are most proud of. Definitely. And that is your opportunity to shine, like tell about things that you did right? And tell me about, like we discussed before, one challenging experience you experienced during your medicine. One, again, super important question is, where do you see yourself in 10 years? Right? And I can tell everyone like how I used to answer, and there's no correct way of answering it. Just be honest. If it's a fellowship, sure, mention it in a way that you feel that it's important, but it's not everything. I used to answer like, I genuinely see myself excelling in med ed. I want to make medically mediocre bigger and really align myself with more residents, more people who share the same intent. Possibly once I'm a neurologist, I feel comfortable in taking my days. I want to use that time to expand my YouTube. I want to use that time to travel to universities to help teach people how education can be fun and entertaining at the same time. And that's my genuine dream. So I can talk about it like that, and that's interesting. For some people, they can be like, I want to like I want to ultimately own a lab and have genuine research interest. For some people, it can be just be a part of a university, go into academics, uh, or for some people can be possibly to pursue a fellowship. But make sure you have a very clear cut answer to the question, where do you see yourself in 10 years? That's a very fair game kind of a question. So great job, Isha, there. Again, you did great for being so unprepared, and I'm very, very proud of you. But before we wrap up, any other questions that anyone else has? And whenever there's a one-to-one mock interview session, I think we can go in more personalized questions, sometimes like the kind of questions that we are uncomfortable with, because I didn't want to ask them here because they're like very one-to-one questions. Some questions that you think are really asked, like, can we really ask them? Like, there are questions that I will tell you, how do you go about them? Like, sometimes they're asked, are you married or are you not married, or what's your marital status, which technically aren't the right questions to be asked. You cannot ask them because you cannot choose an interview candidate based on those questions. But I mean, what if you get asked those questions? How do you go about them? And then there are questions like, which just put you in the spotlight, like India, like I would say, like, India is the best place you can practice medicine, and why do you even want to come here? Like, why do you want to get out of the system? And they might push you in a way where you feel like, I'm feeling so uncomfortable, and how do you respond to that? And sometimes things can happen, like sometimes your laptop switches off or the internet connectivity is terrible. How do you go about that? How do you respond to that? So I think I will be happy to address those questions whenever I can make our time, or at least in the mock interview sessions. Honestly, they're going to be very limited because it's difficult for me to take out time, but I'm going to try my best to do that. But hopefully this session answers most questions for everyone. And just make sure you stay confident. Just to give you a hang of it, interviews can be super comfortable, can be super exciting, can be sometimes anxiogenic. Don't let your bad experiences or things that make you feel that you didn't do good affect your future interviews. Give your best shot at every single interview. Besides that, if there's any feedback, anything that anyone wants to say, any specific question you have in the last couple minutes, please feel free to unmute yourself, turn on your videos, or say anything that you guys have.
I had another question I wanted to ask. Sorry.
Yes, absolutely.
Actually, it is not related to the interview. So, can I still ask, or do you want to give others some priority whose questions are specific related to interviews?
Okay, so what we're gonna do is you can put your question in the chat box, and let me see if I want to address it right here. And
Okay.
otherwise, I'll reach out to you with that answer. Okay. But until then, thank you so much, Sreshtha, Jagriti, Harbir, Utkarsh, Purvika, Diksha, Kaustubh, Rubab, Avishka, Fatima, AMSA India, obviously, Sneha, Surbhi, Toshiba, Anuya, Sujal, Sruhi, Eugenia, Priyal, Rajat, someone who's named Anonymous, lovely, Soumya, Priyal, Rajat, Anonymous. I think we covered most of you. Devesh, Niharika. thank you so much for joining. Please make sure you let us know how you felt about the session in the CV, in the feedback form. Have a great good night's sleep, everyone. We'll put a feedback form in the group as well. And please feel to follow us as well. Thank you so very much. And Isha, I will get back to you with the CV thing. And it might help, like I have previous sessions on CV building on my YouTube as well. So what we'll do is put a link of my YouTube channel. Just type us. Okay, wait. We'll put it in the group as well. Don't worry. So you can reach out and you'll that'll be helpful. Chaitanya and Sahaj, over to you, and thank you so much for being such amazing people throughout.
Thank you, Dr. Ravi, for such an insightful session. We'll put on the link, feedback link in the group, as well as Dr. Ravi's YouTube channel as well. You can reach out to him whenever you can. Like in the feedback form, you've given a question for any suggestions that you have. So please make sure you fill that. Thank you so much for joining till the end. See you in the next session.
Thank you so much.